So there's one thing that I'm curious. So a scenario, we have a husband and wife, Mr. and Mrs. Smith. Mrs. Smith is has Alzheimer's. And her cognitive level is decreasing. Mr. Smith can no longer protect her and keep her safe. She's starting to wander. So now we need to look for assisted living memory care for Mrs. Smith. Now they're going to have two households. How does that work? I mean, obviously they'll have their house, and hopefully it's paid for. They don't have a mortgage anymore, but property tax. But there's basic living expenses that you'll need. But now they have to pay for memory care for Mrs. Smith. How is that navigated? Because that would be very daunting, having to basically have two households.
So some people do that, but the majority will move together.
Okay.
And you don't necessarily, you can take two suites within a retirement home, or you could take, depending upon Mrs. Smith's ultimate medical assessment of her needs and her cognitive level, like they could be in a 1-bedroom on independent living with some supports for Mrs. Smith. Like
Right.
say at one of our homes, they could be in independent living. She could get her medication management. She could join the Blossom program. So in the day, she's doing all of the Blossom activities, and Mr. Smith's got his own time to decompress and do what he wants to do, go out, go to his appointments, read the paper. They can have their meals together. And he's also, we want to take the care off the caregiver's shoulders, absolutely. But if he's like around, then that's great. They could then have two separate suites if Mrs. Smith really did need the higher supports, like the 24/7 nursing that's constantly on our memory care floors.